Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the Patty Brisben Foundation for Women's Sexual Health. I'm your host, Patty Brisben. With us today is Dr. Michael Krychman, chair of the PBF Medical Advisory Board, to discuss one of our 6 focuses. Hi, Dr. Krychman. Can you tell our listeners a little bit about yourself?
Hi, Patty. It's so great to be here on this podcast with you. So I'm a sexual medicine gynecologist. I have training in OBGYN, but I primarily focus in sexual medicine and the implications of chronic disease. I look at women who have underlying conditions, whether it is depression or cancer or other issues that are impacting their sexual health. So in addition to being a physician, I'm also a counselor and therapist. So I really try to bring in a variety of different facets to the evaluation and assessment, not only the medical side, but also what's going on in their life and their relationships as well.
Awesome.
And, I'm really thankful and lucky that we've been working together for quite some time. And, I really appreciate all the hard work that the PBF is doing in terms of furthering women's sexual health, empowering women to really take control of their sexual destiny. So again, I want to thank you for all that you do, and really excited to be here to talk to you today.
I'm excited that you're here. I'm going to start by asking the most basic question. How common is sexual dysfunction following cancer treatment?
Well, Patty, most people, they really realize that the statistics are, astronomical. Some estimates of at least 50 to 90%. So it's much more common than we have been led to believe. And really, the reality is almost everybody who's had an issue with cancer or a cancer scare, that really changes you. It changes the direction. It changes your focus. It really changes how you view every single day. And it's interesting for women, they talk about, the concern of cancer recurrence, the concern for their families, but up there in their top concerns is their femininity, their sexuality, and how they experience that. And we know, breast cancer, certainly one of my focuses. I do see a lot of women who have this cancer, and it's really exceptionally common. And we can certainly talk about some of those implications as well.
Sounds great. Cancer treatment can vary depending on the type of cancer and the location. Can you explain how surgery, radiation, chemotherapy can affect the sexual function?
Well, let's that's a lot to cover, but we'll get it through. Like, when we talk about surgery, remember it's removing and changing anatomy, and it's the implications of, let's say removing a breast. For some women, this is very much linked to how they view themselves as a sexual being. It's tied to their femininity. So surgery really changes anatomy, and it may change sensation. Women who've had their nipples removed may have issues with sensation. The nipples are very erotic, so they may have changes in their erotic arousal. And don't forget scarring. You're left with scarring, and not everybody heals well. And surgery, everyone kind of says, well, we will do reconstruction. But, 40% of women are not happy with reconstruction thereafter. They feel their bodies are changed. Radiation really changes skin tone. It may change the length of the vagina. It may cause fibrosis or hardening. Imagine if you've had radiation to your upper arm and you can't even put your arm around your partner because it's so contracted and so fibrotic and so hard. Really problematic. And chemotherapy, well, chemotherapy, the biggest issue, not only does it change self-esteem with you if you lose your hair, your eyelashes, your eyebrows, but there's inherent nausea and vomiting. And really the big issue is going into menopause really early. And we know how important and vital estrogen and other hormones are for your sexual functioning as well. So chemotherapy certainly has a lot of issues, and let's not underestimate brain fog and what have you. The other thing, I know this is really important, is what I would call the cytostatic medications. We put women on medications after they're done with treatment, like tamoxifen or aromatase inhibitors. And this is what I call the justice syndrome. We're just going to put you on medication for 10 years. And those medications really have far reaching implications. They affect your bones, they affect your vagina, they affect lubrication. So the justice syndrome, for me is like a renovation. You say you're just going to change the appliances and you're just going to change that.
Mhm.
And then you end up changing the counters and building on an extension and putting on a patio. So this justice syndrome is very common with cancer. And we just do surgery and we'll just do a short course of radiation and just do chemo and just keep you on medications without really understanding that these are all additive and they really have severe impact on a woman's sexual expression.
Ugh. What is sexual self-esteem and how does cancer impact it?
Well, I think the best way to explain that is, when was the last time we really looked at ourselves in the mirror, completely naked, and look at ourselves and embrace our body and embrace how our bodies have changed and how our bodies are vehicles of sexual expression. The lumps and the bumps and the changes that we all have. So sexual self-esteem is just how we view ourselves as a sexual person. For some people, it's their smile. For some people, it's their eyes. Other people, it's their breasts. It's how they feel and what makes them give them their kind of mojo to be, sensual or sexual. So, very often when you have a lot of impact, someone really loves their hair or and that's really part of their personality and what have you, having cancer can really damage that. So we see that women who have cancer have not really embraced what I would call the new normal. And again, everybody says, I want to go back to the way it was before. And, the first step really is understanding your life is forever changed. Your body is forever changed. Your experience, your life, your sex life, your relationship has forever changed with the impact of cancer. That doesn't necessarily mean it has to be all bad. So I want to put that caveat in because being in the cancer care business for so many years, I have a lot of women that really feel empowered thereafter. And what I mean by empowered after the cancer experience is they really realize how vital and how short life is, and they embrace their relationships or they start anew. They realize, they were in destructive relationships that were not really supportive. And this is the time of me and focusing on themselves. So it's not all bad. They say, they like to live life out on the branches of the tree of life because that's where all the fruit is. So they really embrace all the natural good things and they really are vital. So it's not all terrible. It changes you. But certainly there's a lot of effective treatments that can help women reclaim their sensuality and sexuality after cancer.
That's good news. When you're going through cancer and the treatment takes a toll on you physically and emotionally, we don't talk about the impact that it has on our partner. Um, and not everyone is comfortable talking with their partner about the changes in their sexual health. How can we open these lines of communication and why is that important?
Well, I think, for me as a sex therapist, I think looking at the couple, whether, you're involved with a person of the same sex or you're involved in a heterosexual marriage, I think the relationship is certainly impactful. And I've seen everything from, a partner put the cancer patient on a bus with divorce papers as she was going to go get her chemotherapy, to partners who are there at every visit. So I think the important thing to recognize is that cancer affects everybody. It affects not only the partner and the relationship, but it affects the dynamic, right? So It may be role reversal. And a lot of men may feel angry, right? They may
Right.
feel angry because they didn't sign up for that. They didn't sign up to make peanut butter and jelly sandwiches for the kids and be the caretaker. They wanted to stay at. They wanted to be the worker. Um, so I think the important concept is try to bring your partner to your visits. Try to engage them so they are seeing things firsthand. There's a lot of good resources from the American Cancer Association. There are other ways that partners can be involved. And again, I think it's very important to, progress from physical intimacy, being in the same place and same time, sharing, feeling close, physically close, and then emotionally sharing. Um, and I know it's challenging, but I think if you broach the topic or you get your healthcare professional to broach the topic, it'll really be at ease. And it's very important to recognize that. And many cancer institutions have trained professionals, and they really want to look at the partner as a partner, not as partner as caregiver. So again, a lot of different roles to consider.
Yeah, we got to remember that our partners are not clairvoyant and that we do have to open up those lines of communication, because I think when you open that up, you both understand each other more so. And I think the relationship is a lot better. And people sometimes hide from their feelings, and that's not good. So I thank you for talking about opening up those lines of communication. Sometimes that always strikes me that when reading studies about survivorship and sexual health is how few doctors talk to their patients about navigating these changes. If someone is listening and wants to discuss this with their doctor and their doctor hasn't brought it up, how can they feel empowered to do so?
So, Patty, that's a great question. And I think the challenge is, there are not many healthcare professionals that are focused on sexuality like myself, or who are committed like you to bring forth that power for women to do that. Um, we have a resource at the PBF, which is really about choosing your healthcare team, choosing your
Mhm.
sexual healthcare team, and we also put something in there about when it's time to kind of break up with your doctor. And I think it's okay. A good doctor is never afraid of a second opinion, and I would empower women to try and broach the subject and recognize that healthcare professionals have their own barriers. They don't know much about sexuality, how to treat it, but just because they don't know doesn't mean they can't find you resources. So there are certainly a lot of resources in major cities. All their cancer care have survivorship centers. There are a lot of resources online, including the PBF, in terms of how to get empowered, how to talk to your clinician. Sometimes you don't even have to talk to the clinician. Bring in an article, write it down on a piece of paper, give it to the allied healthcare professionals, talk to the nurse, bring a friend if you're comfortable. And I always tell women, sometimes the best thing to do is to practice. Practice in front of the mirror. Say the words, say the word vagina, say the word sex, say the word painful intercourse. Becoming more familiar with those terms alone
Mhm.
will allow you the opportunity to broach those topics with your clinician. And again, remember, nothing is set in stone. There are professionals out there that want to help, that have a lot of tricks in their toolbox to make things better. And it's okay to get a second opinion, a third opinion, a fourth opinion. It's really important to be empowered to take control. Because if
Right.
you are going to wait for your provider to talk to you about that, you're going to be waiting and waiting and waiting. So it's really important.
You have to be your own best advocate. And so when you go to your doctor, you've got to be prepared. And I love the fact that you said it's okay to fire your doctor if need be. You've got to find people that you're comfortable with, and it does take a village during
Right.
this time. And it's just not about one doctor. You need a team. So
Right.
thank you for bringing that.
Yeah, and
to
I
the
say,
forefront.
I say, being on the cancer journey is like being on a cruise. You have your captain of the ship, which is your oncological team, your surgeon, your radiation specialist, your chemo person. You are the passenger, and everything else falls upon the cruise director, which is really about sexuality, hot flashes, bone health. Um, and survivorship, I've been doing survivorship for the past 2 decades. And if we think back, it wasn't too long ago, we were having parties and in the chemo unit and saying, you're done, go live. But we never gave people a plan of how to pick up the pieces after the experience. So it's not only about sex, it's about hot flashes, it's about your body image, it's about your bone health, and also the late term effects, of chemotherapy on your heart, on your bones. And not to mention your relationship with your children as well. So again, far reaching implications, but survivorship is new in its infancy, and I have to tell you, it's the last stage of cancer. We are all going to experience disease, and survivorship, whether it's 1 hour, 1 year, 1 decade after cancer, we have to optimize our wellness and our sexual health as well.
I want to thank my guest, Dr. Michael Krychman, for a great conversation this morning. For more information on the Patty Brisben Foundation for Women's Sexual Health, our 6 focus areas, and to download our Let's Discuss Patient Pocket Card to start a great conversation with your doctor, visit thepattybrisbenfoundation.org. Remember, sex care is self-care and sexual health matters.
Thanks, Patty.
Thank you.